It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. Let's get today's show started with plastic surgeon, Dr. David Altamira.
I had a double mastectomy and they needed to round out one of the breasts with more tissue. So they took it from my stomach.
She'd always been bothered by her stomach. Her stomach was kind of bulging and out of proportion to the rest of her body. And she thought, you know, I went through this trauma with the breast cancer. Now it's time to do something nice for myself. And so she elected to go ahead and have the tummy tuck to improve the shape of her stomach.
I've had 4 children, 2 naturally and then 2 cesarean. And you start to get a pouch and scar tissue buildup. So, you know, I'm gonna look sexy again, feel sexy.
A tummy tuck can really benefit a wide variety of people. Usually it's what we see is women who just have extra loose, saggy skin in the abdominal area. Oftentimes it's either from pregnancy or from weight gain. They've tried dieting, they've tried all the gyms and working out, and they still have that just loose, saggy skin, or that little just pooch or bulge in the lower abdomen that they just cannot get rid of.
The difference is looking at myself and not seeing a stomach protruding, where I can put on clothes and I feel good. You know, I feel sexy. You know, I can wear a bikini, where I couldn't do that since 4 children ago. So, you know, it just brings that sexiness back.
She had a dramatic improvement. Before the surgery, she had just a very thick layer of fat on her stomach. She had stretch marks, loose, bulging skin, pretty much all around her entire waistline. After the surgery, we were able to remove a great deal of skin and fat and give her a nice, smooth, flat contour. A great deal of the stretch marks were removed. Everything was nice and firm and tight once again.
Oh, after having 4 kids, I've always wanted to have a tummy tuck. I just, you know, wanted to get back to me. I got my sexy back.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options. For more information and to check out hundreds of videos, head to our website, bestdocsnetwork.com. Now let's go ahead and introduce you to our next doctor, gynecologist, Dr. Meredith Morgan.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically two groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
Chest pain can be a scary thing. There are bad causes of chest pain and not so bad causes. So how do you know the difference? Well, generally the bad causes of chest pain, for example a heart attack, occur with a gradual onset. For example, the discomfort comes on gradually and then goes away gradually. It's usually exertional when you do things like run up a flight of stairs. It's usually dull, not sharp, and that means not like a knife. Knife-like chest pain doesn't tend to be heart-related. Also, if it's heart-related chest pain, you'll tend to get other symptoms like shortness of breath, you'll get a cold sweat, you might even get nauseated or have the pain go to your jaw or to your arm. Now, non-heart related chest pain is a lot easier to figure out and yet not nearly as scary. For example, it's usually sharp, it's usually sudden, it's usually aggravated by motion. For example, if you have chest pain that's worse when you move or reach or bend or arch your back, that's generally muscles or nerves. And that generally lasts longer. So that's the way you can figure out whether it's heart or not heart, that and whether it's exertional. If you go up a flight of stairs and your chest pain gets worse, and that's pretty predictable every time you go up a flight of stairs, that may be your heart. Check that out, especially if you're older.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute. For additional medical
Requesting an appointment is simple. Just head to our website, bestdocsnetwork.com, go to the doctor's profile page, and click on the Request an Appointment tab. And you can even request an appointment with our next doctor. It's interventional cardiologist, Dr. Annie Varughese.
I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varughese talked to me during the recovery time, and I asked her in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is It's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
Women in particular, with Go Red for Women, to listen to your body and know your symptoms.
The most important thing about cardiovascular disease is the #1 killer of women in this country. And 50% of women or men with cardiovascular disease die suddenly, without any symptoms, without any warning.
I just believe getting the word out to women especially. We always are tired and run down and raising kids and going here and there, and we might just think, oh, we're just tired, my neck hurts for some reason, and it's no big deal, but it could be a sign of a heart attack or a stroke.
And women, you know, are just, and they're, as we know as men, are different. And they present differently. Fortunately, stroke-type symptoms are about the same, but again, another large focus for us is heart disease, and they are completely different in the way they present as a general rule than men.
Cardiovascular disease and the awareness for women is such a tremendous topic, and that's why Go Red for Women is such a marvelous cause, and I just want everybody to support it.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within, just that day I was up walking around, you know, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine.
I think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Another reason to stay hydrated throughout the day is because your brain is composed of 75% water. Your brain will also begin shrinking 0.25% in mass each year after the age of 30.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1 3/4 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day, because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice. Now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
High cholesterol is a major problem in this country as well as in many countries around the world. High cholesterol leads to atherosclerosis, blockage of arteries that affect many organs throughout our bodies. So how can we effectively treat high cholesterol? There are medications, but sometimes medications can cause multiple problems for patients, multiple side effects, muscle pain, weakness, breakdown of muscles, liver dysfunction, to name just a few. So we know that natural has always been the best, and we look for natural therapy with regard to cholesterol reduction. There is something that we use called Bio's Life Slim, which is a fiber product created at Stanford University about 20 years ago to treat high cholesterol in those patients who are intolerant to medications. It's been there for 20 years, but not many people know about it. We use it in our practice, and we've taught many doctors how to use this effectively to lower cholesterol. LDL is lowered by 30%, triglycerides lowered by about 50%. So ask your doctor about Bio's Life Slim. Look for it. It's an amazing therapy, and it will help you to change your life.
For more information on any of the amazing doctors that you've seen on our show today, head to our website. It's bestdocsnetwork.com. And now let's go ahead and check out oral surgeon Dr. Paul Metz.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their 3rd set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion, and it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Let's talk about grief and depression. There's a big difference. We all have grief. We lose a favorite animal, we lose a loved one, we lose a job. These are things you grieve over. Depression's a whole other thing. That's a chemical abnormality in the brain. It often needs medications to get well. Grief can lead into depression also, so it's important to know the difference. And there are several ways to know the difference. Number one, grief tends to be more short-lived. It may last a few weeks, a few months, in rare cases, years. And depression tends to last longer, more along the range of months and years. Also, and this is the most important factor, is grief tends to progressively improve. You get a little better every few weeks, every few months. You can look back and see that you're improving. Depression doesn't act that way. It tends to stay the same, stay bad, and get worse. You feel anhedonia, which means lack of joy. If you have grief, you need time, you need help, you may need support groups. But if you have depression, you may need medication. Try to tell the difference and search for help.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education and the Medical Minute. For additional medical
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She was in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club. And so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, they want to know how I did it, and I'm very open about how I did it. I was like, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
That's going to wrap up today's show of Best Docs Network, the show featuring some of the best doctors in the Houston area that are really changing people's lives. For more information, head to our website, bestdocsnetwork.com. And if you have a question or a comment, we love hearing from you. Send us an email at info@bestdocsnetwork.com. I'll see you next week.